Welcome back, America. I'm Hugh Hewitt. Lauren Stewart is Federal Liaison Officer with Americans for Prosperity, a sponsor of my program. Lauren, welcome. I want to know, I've got Majority Leader Thune coming on tomorrow. He wants to talk about the Schumer shutdown. What are Democrats asking for, and why is it so absurd?
Thanks for having me, Hugh. So, number one, the reason that they're asking for anything is that Republicans in both chambers put forth a clean CR simply to keep the government open. This is the same exact bill that Democrats voted for just 4 months ago. But in terms of their demands around this very short-term CR, we're talking about a 7-week CR, include things like making the Biden COVID credits permanent. So this is being sold as regular Obamacare, that Obamacare is expiring. That's absolutely not the case. These are boosted Obamacare subsidies that Democrats put in place during the subsidies. These subsidies removed any income verification and fraud checks on people getting free health insurance on the dime of the United States taxpayer. So those were put in place through the American Rescue Plan. Not a single Republican voted in favor of it. And then they were extended through the Inflation Reduction Act in 2022 because the Democrats said, the pandemic is not indeed over. So, but that's twice that they voted for these to expire. So when Democrats are saying this is Republicans' healthcare crisis, this is actually something they fully created, completely absent any Republican support, vote, or input on the process. So they're asking not only to have those Biden COVID credits extended, but for them to be made permanent. Now, when they asked the Congressional Budget Office what would happen, what would be the impact if they were made permanent, the Congressional Budget Office came back and said that middle-class families would see $19,000 in out-of-pocket costs, and about a third of their medical claims would be denied. So that's a huge aspect of what they're asking for and what they're willing to shut down the government for. In the end, they're really fighting for insurers' profits with these things because insurers have banked $40 billion per year ever since these subsidies have been in play. And they want to make sure that they continue to lock that in. But it is not helping American families. It is not helping American patients. And this is the exact thing voters in the 2024 election voted against, the status quo of bad politics and bad policy from the Biden administration and Democrats.
Now, the way I've been reading this, Lauren, if they went through regular order and they got into some reforms about Obamacare and they wanted to trade tax credits for able-bodied checks to make sure that we're not funding people who aren't working, I think that's a proper legislative discussion. I'm in favor of that. I don't think they just came up with what they thought sounded like the best reason to shut down the government because they want to fight. I'm sort of a political realist. They don't really want this. They know they're not going to get this. They just want to shut down the government, don't they?
It is definitely in Chuck Schumer's, advantageous benefit to shut down the government. He got a shellacking in the spring when he voted to simply keep the government open. I always find it so ironic when a Republican majority passes a clean CR and Democrats don't want to shut down the government when regularly they absolutely don't want to because the horrible impact that it would have on the federal workforce, right? There's no talk of that now. But in terms of why they're doing it now, I think it's also really important to point out that these subsidies, the Democrats set to expire at the end of the year. They didn't set them to expire on October 1st at the end of September. The reason they're making this a shutdown play is so that they can lock in insurer profits for the following year. If these subsidies do get extended or reformed in any way come December, due to the fact that insurers have to send their premium notices, starting October 1st.
You unlocked the key for me because I've been wondering, this is just regular order stuff. If they want to negotiate for this, they do it in the Approps Committee. But now you just explained it to me. They're just doing a rollover before open season.
Exactly, because it's October 1 that the insurers have to send their letters. So that's why the Democrats are making this fake urgency around the situation, but they can't even stand having their insurer friends miss out on 1 year of $40 billion in revenue.
Now you're the senior liaison, right? So is this going to work? I think Thune is not going to bend. I do not think the Republicans are going to bend. They'll let the Democrats close the government for as long as they want. That's what I think. You got 30 seconds. What do you think?
I think that's the best move. I think putting American patients and families over insurer profits is the way to go. And Senator Thune has really come forth and said, this is the Democrats' problem. They created it. They need to fix it.
Lauren, great to see you. Thank you for joining me. Americans for Prosperity, great sponsor of the Hugh Hewitt Show. They always have the facts, and the light bulb goes on occasionally, even when you're slow with math like me, because of people like Lauren Stewart. Thank you, Lauren. I'll be right back. America Vic Mattis is next. Stay tuned.
Portions of the Hugh Hewitt